It's 10:30, so we'll get started. Call the meeting to order and welcome everybody today. Your attendance in person as well as on online on Zoom, I believe it is, and glad to see everybody here. So at this time, we'll have a roll call, and if you're not accustomed to this, if you'll press your button at your microphone, the members, that'll get it out to everybody.
Representative Shedd. Here. Senator Here. Smitherman. Commissioner Boswell. Commissioner Here. Okay. Commissioner Brown. Here. Miss Burton. Here. Miss Camp. Senator Figures. Dr. Godfrey.
Here.
Miss Hales. Here. Representative Hall. Miss Linville, I'm sorry. Here. Director Longshore. Here. Mr. Lohorn.
Here.
Miss Matthew. Here. Judge Mobley. Representative Shaver. Here. Deputy Commissioner Smith. Here. Senator Stutz. Miss Tessmer. Judge Wood.
Here.
We have a quorum.
Okay, thank you. The next item of business is to approve the minutes of the last meeting. Do I hear a motion? And when you, if you'll state your name when you hit your button, I'd appreciate it so we'll know who everybody is. I'm sorry, I'm not good on names, so I'll do my best.
Joe Godfrey, I move we adopt the, accept the minutes, approve the minutes.
You hear a second?
Keith Lohorn seconds.
Okay, any discussion? Questions? All in favor say aye.
Aye.
Opposed, no. Motion carries. Minutes are approved. On new business, we have established an email for, we want to hear, as I think the most important thing we can do at this stage in the new commission is to, number one, get a little more organized, but the most important thing, I think, is for us to hear from grandparents raising grandchildren, what the barriers are and what the things that we maybe could address as recommendations to the legislature or to policy that would improve the situation with them. And we have established an email that goes to our clerk, Erica Hammonds. And by the way, Erica, thank you for all your work, and we appreciate keeping us going like you have, and you've just been real busy lately, and I very much appreciate her work. So the email, I think we sent that out to everybody, but it's help me out, Erica. I've already .gov. Okay. So we'll get that. If you don't have it, we'll get it for you. We want to get that email out to everybody that we can, so that people can start getting information to us about that. So anyone have questions on that? The second thing is our committees, and I think that we talked in our first meeting some of the things that we had heard from our grandparents that are raising grandchildren, is that there's some issues that it's not being critical of either, but there are just some things that probably folks don't realize, that in the unique situation that they're in, dealing with the school systems and also with the courts, that committees, and if you're interested in, as commission members, if you're interested in serving on a committee, I think everybody has my email, and hopefully you have my cell phone, so you just email or text me that you're interested in serving on that committee, and then we'll get that organized. When it's later in the meeting, we'll be establishing our next meeting, and we probably, if it's all right with everybody, I'll say this so you can be thinking about it, we probably do that sometime in January to give our committees time to meet and work through our committees, our working committees, or to address the specifics of that committee. So we have those two committees that we'll be establishing and be getting to work. Do you members have suggestions of other committees that we ought to have? It's open to everybody on the commission.
This is Keith Lohorn. I think, of course, education is very important. Judicial is one of those that we also need to look at, as that is one of the issues that grandparents are having a big fight with as they try to get custody of their children. I think we need a strategic plan as we move forward. And of course, the legislative, as you just said. And I think we need to start planning how we're going to do our public hearings. Now, whether that needs a committee or not, but I think we need to all have the same voice, no matter whether we go to Mobile or whether we go to Huntsville. We all be able to tell the same story. And there are partnerships that we need to establish also as we move forward. So I think we need a committee to look forward at that.
Okay, and thank you. Anyone else?
It's Jean Brown. I wonder whether we might need a legislative subcommittee as we might discover areas where we think the law could be improved or changed.
Okay. Thank you. Others?
Joe Godfrey. I was asked to serve on here because of the faith community. Is there some way we could have a committee that specifically relates to the faith?
Okay.
Churches and synagogues and so forth. So
I'm making notes as we go. And Erica's making better notes.
I'm Darlene Matthew, and I think we should have something for housing because so many grandparents that live in senior housing, and when they get their grandchildren, they lose that and they're forced to move into the expensive housing market and, pay full rent, and most of them are on Social Security, widowed or single, and we need to figure out some housing that these grandparents can take their grandchildren to and be able to afford to live there, or some type of assistance to help them.
Okay, thank you. Others?
This is Michelle Linville. And Keith, when you said partnerships, were you looking at community resources like this? Like those could be almost subcommittees of the partnerships, like continuing education for the grandparents, faith-based initiatives for the grandparents, housing for the grandparents.
Absolutely, that could be just a myriad of things. Absolutely, that would probably be the best way of handling it.
That was kind of along the line of my recommendation is how do they access community-based services that are already in existence and know about them. So I would be interested in that.
Okay.
Judge Williams, I think some of that would or could go up under the umbrella of a social services committee. A lot of these grandparents would require probably some social services, and with the judicial parties serving on this commission, as well as our DHR representatives, I think we could address some of those social service needs.
Thank you. Others? Okay, we appreciate everybody's ideas and thoughts, and as we go along, we'll continue. If you think of something else, we'll be glad to hear from you. As we mentioned, I think hearing from people throughout the state is a big goal of this commission. I think you have a handout. I know you have a handout that Erica got for you on some potential public hearing locations. So obviously, I think if we do 12 across the state, and if there's others that you may think we need to include besides these 12 locations, I don't think the commission can, between now and February, can go as a whole to every one of them. So what I would like to see us do is each person or anyone that's interested in being the coordinator for a public hearing, and it may be, you may be the only one from the commission that's there, but I'll try to be helpful as we work on this. But if you're interested, does everybody? I think everybody has that list. Anybody that does not have anybody on the commission and our folks online, we'll get that to you as well. It was emailed to everyone. Okay, good, thank you. So what I'd like for you to do, if you think there's somewhere we should have a meeting that is not on the list, go ahead and say that now. And if not, then be thinking and let me know if you're interested in coordinating one of these locations throughout the state to hear from our grandparents raising grandchildren.
Mr. Chairman?
Yes.
I would suggest Gadsden,
I was about.
and I'd be glad to coordinate that one.
Okay. Others?
This is Concetta Burton. I would suggest Selma.
Okay. Others?
I'm on my phone. I can't see the list. Do you have Huntsville on there?
Yes, ma'am. Yes, ma'am, we do.
Okay, thank you.
Thank you. Okay, we'll work on that and get those meetings scheduled but please let me know by email or text if you're interested in coordinating one of these locations. That would be helpful. Okay, and again, as we go along in the meeting, today's a good working day for us to get some work done toward what we're trying to accomplish. So speak up and we can even go back to where we've already been on the agenda if you want to, if you need to. Keith Lohorn has going to make about a 10-minute presentation on a one-stop shop concept that has been proposed in some other areas, and then we'll have discussions, and he will answer questions from anybody on the commission about that. Thank you for doing that as well.
Absolutely. Thank you, Mr. Chairman. I met Dr. Ali Caliendo about 4 years ago. She is the executive director of a nonprofit in Nevada called Foster Kinship. And it is one of the nation's leading organizations where grandparents have the opportunity to go for under one roof and get everything that they possibly need as far as information. And her organization started out relatively small, just acting as the Kinship Navigator program there in Las Vegas. And now it is transformed into several organizations, grandparents to teaching the grandparents to helping the kids to and the whole bit. So her organization has grown from relatively small to a very nice. They're in about a 12,000 square foot building. Allie started Foster Kinship in 2011. She's a former foster parent herself, and now she's an adoptive parent of two children, and she's married to her husband that also works with her. Her goal was to basically strengthen the kinship caregiver. And when I'm talking about the kinship caregiver, I'm talking about the informal, and we have to describe the difference between informal and formal. Informal are those grandparents that are outside of any assistance from the government. There's no DHR involvement. there's no state agency involvements. And then there's the formal, which is those people that DHR offers for kinship. Therefore, they get some of the stipends and other benefits that are afforded foster parents. But Dr. Caliendo actually has now, she started off just informal, now she does both of them, but her focus is mainly on the informal side, since the numbers are far greater for informal than there are for formal. Foster Kinship is now a statewide navigator program for Nevada, and it's the only nonprofit that does what she does in that state. She's funded by the Nevada Division of Children and Family Services, where she gets the majority of her funding, but she also gets funding from Clark County, which is Las Vegas, from their Department of Family Services. She gets the funds from the Title IX E-Fund, along with grants and donation. She has a board of 10 people, and she has about 15 staffs. Their programs now include the Enhanced Kinship Navigator, Child Welfare Training, and the Kinship Training Institute. And all those together involve case management, child abuse prevention, CPR, first aid, AED, and car seat training, emergency services, legal support, which is by far, in Alabama, I can speak from experience and from any grandparent that's raising a grandchild, that legal support is by far one of the first things that everybody will talk to, because it is the cost is just so outrageous. And from a personal experience, my wife and I spent $40,000 adopting our grandchildren. They offer financial support, and I guess the one thing that they offer is that everyone gets the same information under the same roof. They get the same employee that, you may have one employee that does education and one employee that does welfare or one of the other programs. So everybody gets the same information. You're not switched from person to person or county to county, and everybody gets the same information, which is so vital in this group. You get community referrals, which is wonderful. These employees know where the grandparents are supposed to go, who they can see, when they can see them, and and they give them all the information that they could possibly have. They have a notary, which is very important, because grandparents sometimes need that information and need it notarized, and it's sometimes that costs money. And as we know, with grandparents that are on the informal side, get absolutely nothing. They get no financial support. So just something simple as getting something notarized is pretty doggone important for these folks. Child and youth programs, respite care, advocacy, which is probably one of their biggest things. All of these programs that they do are to increase the caregiver's capacity to meet the needs of the children, which is what the main thing is goal here, is we are trying to meet the needs of the children. The Foster Kinship Model was the first support program to develop and use the Kinship Resource Locator tool. It's a directory of services specific to kinship families, and it's based on the location, the age of the child, and the type of kinship family. The program has been evaluated twice on a national level, and it shows that the Kinship Navigator program in Nevada significantly increases the caregiver's access to services and significantly decreases the likelihood of placement disruption. The child stays in the home, he has the services that they need, and the children grow and flourish. Hallie's program also reduces the, because that's one of the worst things that happen is when you knock on that door and they tell you that you're going to get your grandchildren, and you're 80 years old, and you go, oh my God, what am I supposed to do? And that's one of the first things that needs to be taken care of, because these folks need to make sure that they're cared for as a caregiver. They need to provide accurate information under one roof. That is so far important. And as we go forward with this, I think one of the first things we have to look at is the amount of information that grandparents need, and having under one roof is far better than having a grandparent who's under limited income, who has limited time, as well as other resources. That if we can give that person and that family all the information that they need, it's far superior than anything else. I can tell, okay, now some of you are probably going to be asking about money. So I know that's one of the things you're going to ask. So I actually talked to Allie yesterday, and she gave me some information, saving taxpayer dollars, which is very important, as we all know. Her program. She says, and I'm quoting, "We know our program prevents children in kinship care from disrupting into the traditional foster care system by 3 times. So reducing the cost of disruption and increasing the ability to support children outside of foster care, we save tax dollars that way." Employees. For every one employee that is with kinship, foster kinship, it took the state of Nevada almost 5 employees to do. So there in itself is a cost savings. They're under one roof, as I said, for everything that they do. It's about a 12,000-foot building that they just actually moved into about a month or 2 ago. Nevada pays foster program on a flat fee. It has increased over the years. For just the Kinship Navigator program, it's about $400,000 a year. And with everything that they do now, which is several different programs that we've talked about, and probably far more than I guess the state of Alabama would want to do as a kickoff. But her budget for 2024 has just been approved, and it was for $3 million. Yes, her program, she has now started franchising it out to other states. It depends on the state and who will contract with. In Utah, they work with an existing nonprofit that serves kin. It's about a $10,000 startup and a $10,000 annual licensing fee. In South Carolina, they just started also. They're working with the state 4E agency and working on doing some of their kinship work. They had a $60,000 startup and a $10,000 annual licensing fee. And they've got other states that they're working with and talking with right at the moment. So I appreciate it. Dr. Caliendo is a wonderful person. She welcomes us to either talk to us by the phone or come visit her in Las Vegas and see how they operate. And she does a really good job. I met her about 4 years ago at the National Child Adoption Conference, and she's an amazing young lady. Thank you.
Okay, thank you. Appreciate it. When Mr. Lohorn mentioned this to me, I immediately thought of Commissioner Brown and Alabama Department of Senior Services, and we talked. So I remembered from my days, I retired as director of Coleman County Senior Services Program in my home county of Coleman County. So I know that the Department of Senior Services, in which the booklet that you gave us the other day was very good, and I think, and so we talked. And do you have any comments? Commissioner Brown and the Alabama Department of Senior Services has a network throughout the state of senior services already being provided, and a lot of services that folks may not know about as well. So, Commissioner, would you address our discussion as
Yes,
much
sir.
as you'd like to?
Thank you, Mr. Chairman. Yesterday, after we received the materials that you sent, I started doing some preliminary research to see what's already in place. And Mr. Lohorn and I have had a brief discussion about some of these things this morning. But here's what I found out. And again, this is just a preliminary research. I found out that Alabama currently has an Alabama Kinship Navigator. Now, at this time, it's only a website, and it's not doing nearly what's going on in Nevada. And then I found that there's also an Alabama low-income kinship care program. At this point, I haven't found out there's a lot of funding available for this. I did learn that this funding comes through Title 4E, which I believe would be DHR rather than the Department of Senior Services. We're basically under Title 3. So again, this is very preliminary research that I was able to do yesterday and this morning. But the network that the chairman is referring to is the AAA network. That's the Area Agencies on Aging. There are 13 in the state of Alabama, and they cover all 67 counties. And so that network is definitely in place. Once I became commissioner, I made it my goal to do my best to have a very good working relationship with the AAA directors. They are just the consummate professionals, and I will actually be meeting with them on November 16th of this month.
We'll have questions in a moment. Let me ask you this question. Would there, I know most of the programs are, from my memory, and it may have changed since I retired, but was for age 60 and above.
That's correct.
If you operated a one-stop shop, would there be a problem with a person or grandparents under the age of 60? Would that need to be addressed or changed?
And that's a great question. For grandparents, it's 55 and above.
Okay.
Let me silence this phone.
Okay. All right. That's something that obviously, if this commission wants to pursue, we will have a committee to work on the one-stop shop as you know as well. So, questions about it now from commission members?
Karen Smith, DHR, and I'm going to rely on Judge Williams to help me with this a little bit. DHR does provide the Kinship Navigator program, the website that Commissioner Brown was speaking about. We've done a lot of work over the last couple years. This is fairly new to the department. We've done a lot of work also with Sally Longshore and their, I'm going to say, the one-stop shops with the resource centers as well. So I want to be very cautious in reinventing the wheel, if I want to say.
Absolutely.
Yeah. We've done a lot of work with the court system around kinship, guardianship, and, we've done a lot of work, again, with the resource centers and education. Also with our Foster Parent Association, they have branched out into kinship guardianship as well. So there's supports out there. I think it may be some lack of education across the state that may be a barrier to that.
Okay. All right. Yes.
Yes, what Deputy Commissioner Smith was talking about was our Alabama Network of Family Resource Centers. It's an overarching network that guides and helps provide training and is actually working very hard right now to increase the number. I think we're up to 24 in the state, strategically located, but there are at least 6 to more than that are working to gain their standards. This is something that you just can't call yourself a family resource center in Alabama. You need to go through standards. You have to put together your notebook and be basically approved that you have the capacity to do that. And I could reel off some in the communities that are very thriving, that have been doing this work for over 20 years. We're a proud funder of just about every one of them in the state, and they do a great service for children and families.
Okay, thank you. Judge?
Yes, Judge Williams, I just want to follow on what Deputy Commissioner Karen said. We in the court system do recognize the kinship guardianship program and the court system. It's under Code Section 3812-32, the kinship guardianship program. I think, though, that based on my experience, this concept of a one-stop shop to better familiarize grandparents and others that want to pursue it could be a helpful resource. I know that DHR has the Navigator. I'm not that familiar with it. But we attended a child welfare summit last week in Fairhope. All of the family court judges and DHR put that on. And the statistics show that throughout the state of Alabama, we're increasing kinship guardianship. It is an effort on the part of every court, juvenile court in the state of Alabama, to increase the numbers as far as kinship guardianship, because we find that it's better if we could put kids with their families rather than with non-family members. And so that effort is increasing. It's increasing here in Montgomery, where we're bringing grandparents and other relative resources in under the kinship program with funding as foster care providers that they might not otherwise have. So it is an ongoing process in Alabama as far as kinship guardianship, but the one-stop shopping may be an appropriate resource, because I find that a lot of the kinship resources don't know about kinship guardianship, even though it's a statute, even though DHR has it and funds it. A lot of them don't know about it. So in the courts, we often have to say, well, why isn't this a permanency plan for the child? Why don't we pursue kinship guardianship? And to some, it's a strange concept because they've not heard of it before. So it takes some promotion, but it's something that we're pursuing statewide. Thank you.
Thank you very much. Appreciate that information from everybody.
This is Michelle with Big Brothers. This is making me think of a program that I worked with in Kentucky that was focused on targeted case management to keep children in their community, in their home. I don't know what that was. Okay. And it wasn't that there was a bricks and mortar establishment of a one-stop shop. There was a professional assigned to every family that could help them access the resources where they were at versus having to go to a physical location. And I know the funding from that came from both DHR and Medicaid together, but this sounds like something that could be altered to be a family targeted case management versus a child targeted case management, and meet people where they're at versus expecting them to go to the resources.
Did we have someone? Thank you very much. Did we have someone online that had a comment or question? Okay.
Hi, good afternoon. My name is Kathy Camp, and I'm with Family Guidance Center of Alabama. And I have had some terrible audio issues, so I think I missed roll call and everything else. But I did want to kind of talk. Okay, I did want to talk a little bit about, you were talking about the informal and the formal care in Nevada, and with our program, with our Kids and Kin program here at Family Guidance Center, we are in 67 counties, and it is focused on informal care. So when we start talking about models, I'd love to share more about how we grandparents and because we're looking at the family unit that DHR recognizes as a family, like for childcare. So I would love to be able to share that, because I think that would be able to be a tremendous help within our group.
Okay, well, thank you. We look forward to hearing from you further on that. Excuse me. Anyone else have a question? Okay, thank you, Mr. Lawhorn. We appreciate your presentation, and we've got work to do, but that gets us off on a good start, in my opinion. Now then, do commission members have anything that's not on the agenda that you would like to discuss or bring up for discussion, other than what we've already done? Okay, do we have grandparents in the audience raising grandchildren that would like to come to the microphone and speak to the commission on your experiences or any recommendations that you would have? Just come and state your name if you would, and we look forward to hearing from you. And anyone else that would like to, that's here.
Hi, I'm Terry Smith. I've had my granddaughter since she was born. She is a little over 9 years old now. I'm a single grandparent. When this started out, I worked remote. I was in the mortgage industry for 42 years. A wonderful job, all the bells and whistles. I worked remote for 16 years. This worked out perfect with my granddaughter because I was able to be at home with her. I had a nanny that came in and took care of her. This all cost, yes, a lot of money. I made good money, so money wasn't the struggle for me. I will say it was hard. It was hard, as a single grandparent. My parents were deceased. I didn't have any help. As time's gone by, I have lost my job in the mortgage industry because we all know what it's doing. I have gone from a very nice salary to a $20,000 a year paying job to accommodate my granddaughter that is severe ADHD and ODD from her mother trying to kill her with drugs. Her mother is deceased. She had five visits with her mother before she died. I paid over $80,000 trying to protect this child in a horrible court system that wanted to give my son, an addict, and the child's mother visitation when they were testing positive for meth and fentanyl. I went through a hell that nobody should ever go through. And yes, I did escalate it. Mine was which it's known, a complaint against the juvenile judge in Mobile with Judicial Inquiry Commission. That was me, another $5,000 that it cost. It is a rough road. I never thought I would see this side of it because I had a good job. I'm in great health. I'm in great physical condition. I can do all this. But now that I'm in this situation, I'm in trouble. I don't know what's going to happen. I wonder how much groceries we can buy. I was speaking with Darlene. I said, never in my life, and I've raised 2 children on my own. Never in my life have I gone to a grocery store with a calculator. But I have to work a certain schedule because of my granddaughter. She can't be in after school. Her medication has worn off. She can't be in after school. It's not a choice. It's not, I don't want her to be. She can't be. Her needs have to be met. And people, unless you have children with whether it's autism, whether it's ADHD, ODD, it's a rough road in itself. But then when you're financially struggling and you can't get any help, it's hard. So to see this formed and people trying to look out for us, and I don't exist in the system. I was never with DHR or foster. I never got any of the help. All I got was the hell that I went through with court and some workers that were not quite so above where they should be. But we need help. Now I see the other grandparents that I have helped, that I have been able to help in the past. I'm one of those grandparents. My child won't have the big Christmas. It's okay. I'm more worried about food and keeping food on my table is what I'm worried about. That's what I'm worried about. So I'm grateful to all of you. This is real. This is real. We're not begging. We're not saying, oh my gosh, give, give, give. I am a real situation that this has happened to me now. I've always been the giver my whole life. So it's hard to be in this position. It's really hard. So thank you all for what you are doing.
Thank you for your presentation. Others? Anyone else in the audience?
May I speak for a moment, Mr. Chairman?
Yes.
Ms. Smith is just one of almost 60,000 grandparents that are raising their grandchildren in the state that receive zero help. Her story can be told 59,990 more times again. Most of these grandparents, like Ms. Smith and myself, our children were addicted to drugs, and the babies were born addicted. And these children are suffering through so many different things that you get when you're born addicted, whether it's autism and all the ODD, the ADHD, the ADD, the RADs, the SADs, all these other things you can throw at them. And these children are the ones that are suffering. So I think the key here is that grandparents are trying to find a solution to help their children, because the children are the future of this country. And if we don't do something, we're going to be in a whole lot more trouble than we are now. So, Ms. Smith, thank you. Thank you very much for what you're doing, for stepping up and doing what you didn't have to do, but you did. And I applaud you for what you have done. Thank you.
Okay. Thank you. Have another presentation.
Thank you for letting me speak for a few minutes. I'm Marcia Rollerson. I'm a pediatrician in Bruton, Alabama, where I have lived and worked since 1980. 6 years ago, I retired from general pediatrics, but I continue to take care of a little over 100 special needs children. I have written a proposal that many of you have already seen. An often forgotten consequence of the opioid epidemic is its impact on children and their caregivers. Children of addicted parents frequently end up in foster care, but most of them end up being cared for by a relative, usually grandparents or maybe an aunt and uncle. These children have suffered from neglect, if not frank abuse, and arrive in their new home traumatized, scared, and with challenging behaviors. For every child who's in foster care, there are 85 children living with relatives who are not getting any kind of support in Alabama. And my figures said there were at least 50,000. I heard you say 60,000. I won't go through the whole presentation, but my feeling is that a good way to start to help these children is to use some of the opioid settlement money to support our family resource centers with a family navigator who can work with these grandparents and maybe do what you said, the one-stop shop. I have one family who the mother took in a baby after he left the intensive care unit in Mobile after spending about 8 months there with multiple problems because his mother had an abrupted placenta, delivered a 24-week baby, drug addicted. And he continues, he's 7 now and has multiple handicapping conditions. And her husband have been caring for his older brother already, and that now they have a multiply handicapped child. Plus, a few months ago, 3 more children were placed with their care. Unfortunately, it broke the bank. Their house was too small. Their car couldn't carry all the children. I tried to help. I tried to get resources for her. They just weren't there. She was contacted by DHR because of the 3 children that were just placed with her and told her that she could go through this foster program. But she is the sole support for her family. Her husband's disabled, and she couldn't do that. So what has happened made me cry. These 3 children have now been split up. They are no longer together as a family. And I cried for that because I met these children, and I know that the best thing for children is to be with a family member. There is a lot of money coming into our state from the opioid settlement. I think we should have at least a pilot project that would use some of the opioid settlement money to help these grandparents, aunts and uncles who are raising children like your granddaughter who have been impacted by drug abuse in their parents. Thank you.
Thank you very much and appreciate your work. Anyone else from the audience or online? As we say in the legislature in the House, I want to take a moment of personal privilege. I am frustrated. I appreciate the fact that we have funds about the opioid settlement money, but I don't understand as many people have been murdered across our country, even in our state, how that family that started the opioid crisis was not held accountable criminally. And you know, money is one thing, but anyway, that's my personal privilege to comment on that. Anyone else? Okay, and again, we'll hear from anybody at any time that you have anything you want to, commission members that you want to say. Are there other commission members? I know we have several on the commission who are or have raised their grandchildren. Is any one of those want to say anything about your experience? If you do, we'll be glad to hear from you. It's not on the agenda. If there's not I'm sorry, I'll go ahead.
Hi, I've had my grandson since he was 4 months old, and he was abandoned by his mother, who was an addict, and he had spent the first month and a half of his life in the NICU withdrawing from drugs. That was a very horrific thing for him to go through. He had seizures, he suffered in pain, going through withdrawals that he never asked for. So we've had him since he was 4 months old. He just turned 8 in September, and we just got through a court battle with him because the bio mom, after 7 years, decided of no contact, she decided that she wanted to take custody back. So we once again had to go spend thousands of dollars. We went through over a year of court proceedings that got postponed and postponed. And we finally got to court actually a day after our last meeting. And we were treated very bad in court, not by the judge, but me and my husband both were put on the stand. We were just really treated badly by the other lawyer. He was horrible. I mean, we felt like we were on trial for a crime. He actually screamed at us and hollered at us because my grandson calls us mom and dad, which we're all he's ever known. He's never, ever, known his father or his mother since he was 4 months old. So I think that was very unnecessary. But the court system, things we went through, the expenses we went through, it cost us thousands of dollars. I just don't think that we should have had to go through that. And I really feel like after her being out of his life for a year, her rights should have been terminated, my son's too, and we should have easily been able to immediately adopt him instead of going through this. Well, right now we're trying to start the adoption process. It's going to cost several more $1,000s, but I don't want to be drugged back in court by her in a couple of years and have to go through this again. We just want to take care of him, continue our life, and move on. And we don't want this hanging over our head in the future. Thank you.
Thank you for your comments. And your grandchild is how old now?
He turned 8 in September.
Turned 8 in September. And Darlene, and I've forgotten your last name, I'm sorry. Tell us.
Matthew.
I apologize for that, but I'm not good on names, so y'all, I don't know how I ever get elected, but not been able to remember names. But anyway, you have provided for us some what you hope we accomplish with this commission, and it was distributed to all the commission members and those online. It was just brought to us today, so we'll get those to you, scan and get that to you as well. Anyone else, some commission members that are raising grandchildren? Okay, it's not on the agenda, but if there is no objection from anyone, and if there is, let me know. The Alabama Department of Public Health would like to have a member represented on the commission, and somehow I'll take the blame for that. We missed them somehow, and we apologize. But if there's not an objection, we will vote to add them to our commission and designee from Dr. Harris. Does anyone have thoughts on that? If not, do I hear a motion?
I'll make a motion that we add a member from Department of Public Health.
Hear a second?
Jean Brown, second.
Okay. Any discussion? All in favor say aye. All opposed?
Aye.
Okay. Anyone else? All right, thank you. The motion carries. Our next meeting, and again, if anyone has anything before we leave today, I think it's been a very productive meeting. We'll work on the things we talked about, but in getting our committees established that we have discussed, we'll get that worked on and get everybody that wasn't able to attend today, we'll put them on committees. As you know, that's the way it works at church, right? Isn't that right, Dr. Godfrey?
That's right.
So you better come and defend yourself or be online. I'm teasing, of course. But our next meeting, I suggest, if it's all right with you, that we will let our committees work and look at sometime in January, and I would suggest the second week in January. Is that, anybody have thoughts that you want to express? Is a Tuesday, January 9th at 10:30. Does that work for everybody?
That works for me, but just keep in mind that the night before, the Georgia Bulldogs will be playing the national championship game, and I might be a little groggy that next day. Just keep it.
You know, that's a good point. I think watching Alabama play them will be
maybe Georgia and Alabama again
would probably keep us up a little bit. So we might want to move. What about on Thursday, the 11th? No, I think I look forward to watching Alabama play them. Thursday afternoon, would that work for everybody? Like 2 o'clock? Thursday the 11th at 2 o'clock then. Okay? All right. Anyone have anything else before we adjourn? Well, I appreciate everybody's attendance. And those online as well. And we look forward to our committees we get that worked out and the things that's been discussed today.